Have you ever experienced something so terrifying that even after it was over, it continued to haunt your mind? For most people, painful memories slowly fade with time. But for others, the event never truly feels like it ended. A loud noise, a familiar smell, a certain place, or even a simple conversation can suddenly pull them back into one of the worst moments of their lives. This condition is called post-traumatic stress disorder, or PTSD. It isn't simply remembering something bad. It isn't being weak. And it isn't something people can simply get over. PTSD is a real medical condition that changes the way the brain responds to trauma. Today, let's understand what PTSD really is, why it happens, how it affects the brain, and most importantly, how people recover. Imagine you're walking through a forest. Without warning, a tiger attacks. Instantly, your body reacts. Your heart beats faster. Your breathing becomes rapid. Your muscles tighten. Your pupils widen. Stress hormones like adrenaline and cortisol flood your bloodstream. Every part of your brain focuses on one thing: stay alive. This is known as the fight, flight, or freeze response. It has protected humans for hundreds of thousands of years. Normally, once the danger is gone, your brain realizes you're safe. Your heartbeat slows. Your breathing returns to normal. Your body relaxes. The emergency alarm switches off. But for someone living with PTSD, that alarm never completely turns off. Scientists have discovered that PTSD affects several important parts of the brain. One of them is the amygdala. Think of it as your brain's smoke detector. Its job is to detect danger. In PTSD, the amygdala becomes overactive. It begins treating harmless situations as if they are life-threatening. Another important area is the hippocampus. This part of the brain helps organize memories. Normally, it tells us, that happened in the past. But after severe trauma, the hippocampus may struggle to separate past memories from the present. As a result, traumatic memories don't always feel like memories. They can feel like they are happening all over again. The prefrontal cortex, the area responsible for logical thinking and emotional control, also becomes less effective during moments of stress. Instead of calming fear, fear overwhelms reason. One of the most recognizable symptoms of PTSD is called a flashback. A flashback is much more than remembering. Imagine hearing fireworks. To most people, it's just a loud sound. But for someone who survived a war, their brain may instantly believe they are back on the battlefield. Their heart races. Their muscles tense. Their breathing changes. They may duck for cover. Even though they are completely safe, their brain reacts as though the danger has returned. Flashbacks can be triggered by sounds, smells, weather, music, certain words, or places connected to the traumatic event. Nightmares are another common symptom. Many people relive the trauma while sleeping. Some wake up sweating. Others wake up terrified, unable to return to sleep. Over time, they begin fearing sleep itself. Lack of sleep then makes anxiety even worse, creating a difficult cycle. PTSD also changes everyday behavior. Many people begin avoiding anything connected to the traumatic experience. They may avoid driving after a serious accident, avoid hospitals after a medical emergency, avoid crowds after an attack, or avoid talking about what happened altogether. Avoidance feels safe at first, but over time, it actually strengthens fear, because the brain never gets the chance to learn that those situations are no longer dangerous. Another symptom is called hypervigilance. The brain becomes constantly alert, always searching for danger. Every loud sound causes panic. Every stranger seems suspicious. Every unexpected movement grabs attention. Living like this every day is exhausting. The body never truly gets a chance to relax. PTSD can also affect emotions. Many people feel emotionally numb. Things they once loved no longer bring happiness. Some stop enjoying hobbies. Others struggle to connect with family and friends. Some even blame themselves for surviving, even when they did absolutely nothing wrong. This feeling is often called survivor's guilt. Many people believe PTSD only affects soldiers. While combat veterans are certainly at higher risk, anyone can develop PTSD. People who survive serious car accidents, victims of physical or sexual assault, children who experience abuse, people who survive natural disasters like earthquakes or floods, healthcare workers who repeatedly witness traumatic events, police officers, firefighters, rescue workers, refugees. or anyone who experiences or witnesses overwhelming trauma. Trauma doesn't discriminate. The good news is, PTSD is treatable. Millions of people recover with the right support. One of the most effective treatments is cognitive behavioral therapy, also called CBT. This therapy helps people recognize unhealthy thought patterns and gradually reduce fear by changing the way they respond to traumatic memories. Another widely used treatment is EMDR, which stands for Eye Movement Desensitization and Reprocessing. Patients recall traumatic memories while following guided eye movements or other forms of bilateral stimulation. Researchers believe this helps the brain process memories that became stuck after the traumatic event. Although scientists are still studying exactly how EMDR works, many people experience significant improvement after treatment. In some cases, doctors may also prescribe medication to help reduce anxiety, depression, nightmares, or severe sleep problems. Treatment depends on each person's symptoms and needs. If you think you may have PTSD, please don't ignore the signs. If weeks or months after a traumatic event, you continue having nightmares, flashbacks, severe anxiety, panic, or you constantly feel unsafe, it may be time to seek professional help. Talk to someone you trust, a close friend, a family member, or someone who can support you without judgment. If your symptoms are affecting your work, your relationships, your sleep, or your daily life, consider speaking with a licensed psychologist or psychiatrist. Early treatment often leads to better recovery. There are also healthy habits that can support healing. Maintain a regular sleep schedule whenever possible. Exercise regularly, even a short daily walk can help. Practice slow breathing or mindfulness exercises when anxiety becomes overwhelming. Eat balanced meals. Stay connected with people who make you feel safe. Most importantly, avoid using alcohol or drugs to escape painful memories. They may provide temporary relief, but they often make PTSD symptoms worse in the long run. And be patient with yourself. Healing is rarely quick. Recovery is not about forgetting what happened. It's about reaching a point where those memories no longer control your life. Perhaps the biggest misconception about PTSD is that people should simply move on. If healing were that easy, PTSD wouldn't exist. This condition is not a lack of courage. It is not attention-seeking. It is not a personal failure. It is a medical disorder involving real changes in how the brain processes fear and traumatic memories. And like many medical conditions, it deserves understanding, compassion, and proper treatment. The human brain is one of the most remarkable organs in the body. Its job is to keep us alive. Sometimes, after surviving the worst moments imaginable, it continues protecting us long after the danger has disappeared. That is PTSD. Not a sign of weakness, but a sign that the brain is still trying to protect someone from a threat that no longer exists. With the right therapy, professional support, healthy coping strategies, and time, recovery is possible. If you or someone you know is struggling after a traumatic experience, remember this: you are not alone. Help is available. Healing is possible. And surviving trauma should never mean living inside it forever.